For introducing our Better Health program, and this morning we have with us Wade Stiller, who's a naturopath over at the Northside Wellness Clinic, and we're going to be discussing an issue that's been bandied around the media recently called metabolic syndrome, which to all of us, including me and I discovered Richard, we haven't really got a clue about what that's all about. So welcome, Wade. Thank you.
Thanks, Jeff. Good to be here, and good to be back, and of course, helping better inform the listeners as much as possible.
Now, Wade, just on that, we're living in the information age, and subjects like metabolic syndrome seem to be fairly complicated. Where do you stand with all the information out there? I mean, if I jump on the internet and type in pretty much any disease, I can often find all sorts of conflicting information about the same condition and treatment.
Yeah, Jeff, you're right. I mean, this is the danger, I suppose, in the internet. There's a lot of great information out there, but there's also a lot of junk. As far as I'm concerned, as a health professional, my role ultimately is to educate people to the point where they can take control and responsibility of their own health, using diet and lifestyle choices to support their well-being, as well as getting a greater understanding of how their body works and understanding the signs it gives us when something's out of balance. So to start with, I often discourage that that crazy midnight surfing that some people get caught up with to find out the magic solution to their problem, because literally anyone can go and post information on the internet, and some of it may be helpful for one person, yet very, very damaging to the next person. Now, metabolic syndrome has a fairly broad umbrella of symptoms, so although there's a plethora of symptomatic treatments available, this is one time that I'd encourage people who have never heard of it, to jump on the net and do a bit of a search, because it's not clearly defined as a singular condition, so it can get a bit hairy trying to explain.
Yeah, well, that seems like a lot of introduction there, Wade.
So
now I'm really confused. What is metabolic syndrome?
Excellent. Okay, so metabolic syndrome is a name of a group of risk factors that occur together, and they increase the risk for coronary artery disease, stroke, and type 2 diabetes. It's also known as metabolic syndrome X, or syndrome X, insulin resistance syndrome, Raven syndrome after Joel Raven, and here in Australia we've also given it the abbreviated name of CHAOS, of course CHAOS, meaning coronary artery disease, hypertension, atherosclerosis, obesity and stroke. Current data would suggest that it affects 1 in 5 people in the US, and very similar over here, and that prevalence increases with age.
So the condition's actually a collection of conditions that increase the person's risk of other diseases then, Wade?
Yeah, that's right. To break it down further, the International Diabetes Federation have listed the following definition. That is central obesity, or a BMI that's over 30, plus any two of the following.
Sucking my gut.
Tighten that belt. So any two of the following, as well as that central obesity, we're looking at raised triglycerides, that's over 1.7 millimoles per litre, reduced HDL cholesterol, that's lower than 1.03 millimoles in males and lower than 1.29 in females, raised blood pressure, which means above 130 over 85, and raised fasting plasma glucose, which needs to be over 5.6. For any of those conditions, also if you've previously been diagnosed, say with glucose with type 2 diabetes, or diagnosed with high blood pressure, bad cholesterol, you're already in that risk category, obviously, so they're already backed up. In 1999 I should say, the World Health Organization came up with a different set of guidelines, but really at the end of the day we're looking at people who have multiple chronic disease states, including something cardiovascular, something glucose, dysregulation, and something based around cholesterol imbalance, and combination of those.
Yes, well that actually sounds a lot like some of the conditions that I have. Could you just quickly remind us how to work out our BMI, our body mass index?
Yeah, sure. Yeah. It's fairly simple. You multiply your height in meters by itself. So for a person who's 180 centimeters, you'd look at 1.8 and then multiply it again by 1.8, which in this case will give you 3.24. Then you divide that by your weight in kilograms. So just looking at Richard in front of us here, about 180 centimeters, maybe 80 kilos. We'd look at 80 divided by that 3.24 we worked out before, and that would give us 24.7, which, looking at BMI, is just in the healthy range. Well, still in the healthy range, I should say.
So it's weight in kilos divided by height in meters squared.
Spot on, mate. Yeah.
Okay. So in order to have a metabolic syndrome, a person would have to have what kind of tests first?
Well, the only signs that can physically be measured without blood tests is that BMI or a waist-hip ratio, which confirms that the central adiposity or central obesity is there. Of course, waist-hip ratio is worked out by measuring around the waist, which is around your belly button or up to an inch above your belly button, and dividing that number by the measurement around your hips, which is basically the widest part around your hip area. For men, this total should be under 0.9, and for women it should be under 0.85.
Okay, so let's give our listeners a couple of minutes to quickly go and grab a tape measure, okay, and scales, and see what the measurements are. And after the break, we might talk a little bit about just who is at risk and just what can be done to best guard ourselves against metabolic syndrome. You're listening to the Better Health program, and thank you very much.